Yesterday you heard me saying that my privilege as a president is to choose the keynote speeches. They knocked it off the park yesterday. And today we're going to have another keynote lecture that it is not the common keynote lecture that we would expect. The format is different, and it is about music. And I will tell you in a little bit, but I'm going to ask you to wait for 2 seconds, or are we ready? Oh, we're ready? Okay, good, thank you. I'm going to do the introductions all together, and in a second. But the important thing is that the session is about music. And I do feel that music expresses things in ways words will never be able to do it. And we'll have a variety of speakers. The first speaker is going to be Claudius, who is a good friend of mine, and it is a Steinway piano player. He has recorded CDs, has lectured extensively on music and medicine, and the first 15 minutes of today's keynote speech are going to be done by him. And I will be introducing the next speakers as they come. Thank you.
Okay, thank you very much. I feel extremely honored to have been asked to give the Karl Storz lecture. Can we please have the slides up? Okay, thank you very much. So I have two disclosures. So number one, I'm a Steinway artist, and number two, I really like music. And if I were to ask you, is there anybody who hates music? Few of you would say, I hate music. But have you ever thought about why you like music and how this may be mediated in your body? So let's start with an experiment. So each of you, please close your eyes. Horacio, close your eyes. Lean back in your chair. Feel the weight of your body in the chair. Unfold your arms. Feel the weight of your feet on the floor. And now I want you to take a deep breath in, a little bit more, and then release all the air. Let's do it again. Breathe in, almost all the air, a little bit more, and then release all the air. I want you to imagine now you're sitting in a room, the room is quiet, a little bit dark, and you're watching through a window rain falling. And you're looking at this rain, you're hearing the rain against the window, and I will play a piece to you now, a Chopin prelude, and just take note of what the music does to your body. Thank you. Most of you probably would say now you feel relaxed, and for those of you who don't, there's help available, and it's okay to ask for help. And let's talk about why you feel relaxed, and not just about the pathophysiology of music-induced relaxation, but we are surgeons. We want to help our patients. We want to get better, to help our patients better, and let's talk about this. So we have worked over 15, 20 years on this topic, and I can only, in the interest of time, focus on the relaxation part of music in medicine. And music has been a part of healing since the beginning of cultural history, since 25,000 years before Christ, when healing was thought to be mediated through magic, music was already a part of this healing. And it is actually a very recent phenomenon that music is not a central part of healing anymore. So when we started with our investigation, trying to understand how music acts relaxing, I was surprised to find that this very broad and basic idea, how does music act relaxing, hasn't really been investigated in a scientific way. So we went to an intensive care unit, and there were patients who were severely sick after surgery on the ventilator, and we played relaxing classical music to them over a period of 1 hour while they were waking up from their sedation, and we would measure serologic, physiologic, and clinical parameters of the human stress response. And this is a very broad summary, very high-level summary that was the first description of music-induced relaxation. So when you today listen to music, music is being processed on several levels of awareness in the brain, a very aware level if you're tentatively listening, or a subconscious level when you're listening to music in an elevator. It sends a signal to your hypothalamus to secrete growth hormone, and at the same time we were doing our investigations, another group had found that cells of inflammation have a growth hormone receptor on the surface that when growth hormone binds, interleukin-6, the main player, the main mediator of the human stress response, is downregulated. And this is exactly what we found in our patients in the intensive care unit, this inverse regulation of growth hormone and interleukin-6. And as a result of decreased interleukin-6, it binds to the adrenal gland, and stress hormones are secreted to a lesser degree, and we can measure very positive effects of relaxation. I then moved forward with my group to look at other aspects where music could play an important role in healthcare, and I find one cohort in healthcare that is under-researched and deserves more attention are relatives of patients. So in a busy emergency room, we played music to relatives waiting for their family members to be treated, and we used a standardized anxiety questionnaire that not only measures your situational anxiety, but your outlook on life. And what we found in the study was that compared to the control group who wasn't listening to music, female relatives who presented by themselves were particularly susceptible to music-induced relaxation. And inversely from how you would think it would be, your degree of formal education was inversely correlated to your degree of relaxation to classical music. And finally, we were very surprised to find how effective music-induced relaxation is. You get an about 20 to 30% reduction in anxiety, which is what you get from taking anxiolytic medication. And here comes the kicker. When we looked at the questionnaire, the inventory that looked at the outlook on life, the trait component of this inventory, we found that the entire outlook on life had changed in response to music. So now we had looked at the pathway, we investigated how relatives feel about music in medicine. So we move forward to look at how does music impact performance of surgeons. So we designed this clinical trial, and many SAGES members have participated as volunteers in this trial, where in a simulated laparoscopic environment, we exposed expert laparoscopic surgeons here from the audience and novices of laparoscopic surgery to 4 conditions: silence, auditory noise, mental stress, and relaxing music. And let me briefly walk you through the slide. So when we look at silence, surgeons are pretty good, and they improve when they perform a task the second time. And this data looks at accuracy. There are other parameters we investigate, for example, speed. When you look at auditory stress measured or exuded as dichotic music, which is 2 types of music in each ear, so German folk music in one ear, death metal in the other ear, designed to be maximum stressful. It only passed the IRB because it has this euphemistic term, dichotic music, what can be wrong with music. And what you see here, there are some surgeons who are 500% worse when they're operating under the condition of noise compared to surgeons who are just as good as in silence. And we were able to correlate that to the role music plays in those surgeons' life. So the more important the role of music in those surgeons, the worse they performed under noise. If you are mentally stressed, you are bad and you don't improve, you perform the task the second time. And then finally, if you're looking at relaxing music, we found that there's a statistically non-significant difference between silence, but there was a greater improvement when the surgeon performed the same task under the same auditory condition of relaxing music. And we know this from professional athletes who use music to condition themselves and improve their performance, that this works very well. So with this in mind, we then move forward to look at what can surgeons learn from professional musicians to improve their performance in the operating room. And here are some highlights from the study. 1, deliberate practice. What is deliberate practice? Deliberate practice is the mindful practice. So when I come home after work, I don't just want to entertain myself playing pieces to myself. I want to work and practice and get better. And this is how you should operate. You should always think about how could I do this part of the operation better at every single step. Dexterity. Ambidexterity is a critical component of being a successful musician. And there are specific techniques you can use to improve your ambidexterity. And I always tell my trainees, the good surgeon is recognized by the performance of the non-dominant hand. Everybody has a good dominant hand, but it's the non-dominant hand that signifies the good surgeon. Performance evaluation. If an orchestra hires a musician, nobody would hire a musician without listening to their performance. But we hire surgeons all the time without looking at the surgical performance. Occupational injuries. You can't graduate today from conservatory without having taken classes on occupational injury prevention that have to do with posture, back pain, and others. And I think that is something that is undervalued in our current training. And then finally, performance anxiety. You may think that doesn't impact you, but you will be surprised how many surgeons suffer from performance anxiety, and not only trainees, but also staff, which leads to tremor and inferior performance during cases. And there are techniques we learn at the conservatory to improve our performance on stage and deal with stage anxiety. We not only looked at the performance of individual surgeons and how we can improve it, we looked at how we can improve the performance of the entire surgical team using music. And the OR is a peculiar environment compared to other high-stress work environments such as the military, where soldiers come together and their personalities are kind of similar. Somebody who is becoming a nurse has a completely different personality than becoming a surgeon, than becoming an anesthesiologist, yet we need to work together in this high-stress environment. So we surveyed, this is a multi-institutional study where we surveyed nurses and surgeons and looked at how musical taste can be used to unify the OR team to the best possible outcome for our patients. And as you know from marches or dancing music, music has the ability to synchronize people in a positive way. Let me come back to the experiment we did at the beginning where I played music to you. We just completed a study that was born out of a collaboration with NASA where we're trying to compose culturally neutral music for the upcoming prolonged space travel with the upcoming Mars mission, where astronauts from different cultural backgrounds have to be in a confined space for a very long time. And we try to extract elements that can be then used to find music that is particularly relaxing. And we were able to correlate this to demographic factors, aspects that have to do with ethnicity or gender, but other more complex ones. And we have a current collaboration with an Israeli group where we use biofeedback mechanisms and artificial intelligence to find music that is customized and has a very high likelihood and higher probability of being relaxing to you than music selected by a clinician. So with this, I would like to end, and I have a small assignment for you. I will play a short piece for you, and I encourage you to try to identify some of those very simple compositional elements of relaxation. Notice in this last piece, the slow beat of the piece. And other groups have shown before that when you're getting into a piece, your heart rate will synchronize with the beat of the piece. So the rate is about 59 beats per minute, which is a very comfortable, relaxing heart rate. And maybe on other composition elements, see whether you hear a theme presented throughout this piece over and over again, but you will notice that it's actually not a repetition that leads to just a welcoming recognizing effect. It's actually a subtle variation which avoids you becoming bored by hearing the same theme repeated over and over again. I want to congratulate Horacio on his presidency, and I feel extremely honored to have him given the opportunity to lecture today, and I would like to thank you very much. So last piece is a short piece by the German composer Schumann called Träumerei.
Thank you for that. Who would know an HPV surgeon with a PhD in music can produce that music? Thank you. Appreciate it. The next presenters are Suzie Brown and Jack Greenberg. Suzie Brown starts her profile saying she writes songs to process her life. And yes, she has been named Best of Philly on the Philadelphia Magazine and a lot of other accolades. But what she doesn't put that much importance is that she's a cardiac surgeon. She deals with heart transplants as well as advanced heart failure transplants. She's going to play with Jake Greenberg, who we all know. He grew up in a very musical family, and he got his BA in music and history, and for a while, he was doubtful if he wanted to be a physician or a musician. And his grandfather told him to be a physician first, just to pay the bills, but to really have fun in life with music. Jack and Suzie, please.
So thank you, Horacio, for this incredible opportunity. So many times in life, in our daily professional work, we have and face enormous amounts of stress. We have overbooked clinics, complicated and challenging operations, sick patients, complications, and unfortunately, the real fear of mortality and losing those that we try to take care of. We top those off with administrative duties and our responsibilities at home to our spouses, significant others, and our loved ones, and our children. We're pulled in so many different directions and have so many competing tasks that we have a tendency to end up in a state of psychic entropy. Psychic entropy is that feeling of helplessness and anxiety where you're pulled in so many different directions that you begin to fail at all of them. And in fact, that failure happens not only at work, but unfortunately at home. And it can even happen, and more worrisomely happen, when you begin to fail yourself. You stop doing the things that bring you joy and make you your own unique self. And when that happens, burnout and depression, sadly, are not far behind. On the opposite end of that spectrum is the flow state. Flow is optimal experience. It's that feeling you get when everything is clicking, you have no concerns about what's going on, and hours can pass in an instant. So put yourself in the middle of your favorite operation. It's going perfectly. There's no interruptions. You're not worried about your pager, your email, or anything else that's going on. You are completely engrossed in the moment, and you are living in optimal experience and in that flow state. It's something that is very unique to our lives as surgeons, and we have the incredible privilege to experience this in our professional lives more often than anyone else in other professions. More importantly, we get to experience it while doing good and taking care of patients. And it's a unique honor and a privilege that we all have. And it's why surgery is undeniably, I think, the best job in the world. Sadly, a lot of times we have to sacrifice our own personal happiness and joy to have that honor and privilege to be a surgeon. And so while for most of us, I think our passion and our purpose is to take care of patients, we need to do something else outside of work and outside of the operating room to have the power to do that. We have to find our flow state in our personal lives so that we can continue to have the privilege to experience it professionally. For me, that always came from music. I spend as much time in my day listening to or playing music so that I can be a better surgeon and be a better father and husband and be the best version of myself. When I drive to and from work, there's music playing. In the operating room, there's always music playing. And no matter what happens, no matter how bad my day has been or how great it's been, I sit down at a piano or with one of my basses and I play. It might be 30 minutes, it might be 2 hours, it might even be just 5. But taking that time to do that for myself re-energizes me, recharges me, and it allows me to be the best version of myself. Now, as Horacio mentioned, why was it music? I guess it was sort of in my blood. My uncles Michael and Randy Brecker are jazz saxophone and trumpet players. They've been nominated for nearly 50 Grammys and have won 22. My mother, their sister, was an incredibly talented pianist and harp player, and I grew up in a family that was just filled with music. And playing music today still brings me back to my childhood, and it just brings me back to a place of comfort and peace where I can be myself and then be the best surgeon that I can possibly be. So, what's your flow state? What can you do at home that will make you better at work? I would challenge everyone in this room to find whatever that is and commit to doing it every day, even if it's just for 5 minutes. It will make you better at everything else. So again, thank you, and it is my pleasure to introduce Dr. Suzie Brown.
Thank you, Jake. Thank you, everyone, for including me, the ectopic cardiologist, in your conference. I'm really honored to be here. And I think what I was planning on saying kind of echoes a lot of what we've already heard today. As physicians, from very early on, we are taught that our needs, physical and emotional, have to come last. It doesn't matter if we have a headache. It doesn't matter if we haven't eaten. It doesn't matter if you have to go to the bathroom. It doesn't matter if you've just had a tornado come through your city and miss your house by 3 blocks, which happened to me 2 weeks before the pandemic. It doesn't matter if the pandemic is ravaging your hospital and you don't have enough PPE and you don't yet have the protection of the vaccine, and you're worried about your own health and safety and about the health and safety of your family. None of that matters. What do? We get up, we get dressed, and we go to work, and we do what we're called to do, which is take care of patients. Nevertheless, for me, that type of stoicism, day in and day out, started to take its toll. And I think it takes its toll on all of us, whether we're willing to recognize it or not. So when I was a cardiology fellow, I found myself more and more turning towards music as a place where I could express my vulnerability. I couldn't do that at work. I found that I could sing things that I would never dare say. Another thing that was sort of happening for me during my training was that, I had always wanted to be a doctor. I come from a family of physicians. My mother is a pediatric endocrinologist. My father's an adult pulmonologist. My sister's a neonatologist. And I had always wanted to do it. And yet, with every academic accolade and stage of training I had completed, I kept feeling like the happiness that I was seeking was still just out of my reach. And I didn't understand what was missing for me, but there was something missing for me, and I think it turns out it was music. But I wrote a song around that time that sort of expresses that sentiment of being almost there, and I'm going to play it for you now. Bikinis on, but it ain't quite summer. Too late for lunch, too early for dinner. Sitting on your porch, but nobody's home, wearing shoes that I've outgrown. I'm almost there. I'm almost there. I'm almost where I want to be. It's almost here. It's almost here. It's oh so near, but out of reach. Running in circles, running in squares, running into people, running into chairs. They ask me questions, tell me what's new. Oh, I'm just waiting for my dreams to come true. How about you? I'm almost there. I'm almost be. It's almost here. It's almost here. It's oh so near, but out of reach. Hopes and aspirations call for inspiration, perspiration, just that frustration, and by my calculation, you'll be almost there, almost there, almost where you want to be. It's almost here. It's almost here. It's oh so near, but out of reach. Thank you. So during my cardiology fellowship, I started to write songs, as I mentioned, and while I don't have an addictive personality, writing songs was like crack for me. Once I started, I just couldn't stop, and I found myself going to open mic nights around Philadelphia, not telling anyone I knew, and playing my songs, and started playing shows, and I just realized that for me, making music made me feel happier and more at peace than really anything I had ever done, and that I would never forgive myself if I didn't make more time to do it. So I abandoned my American Heart Association career development grant that I was writing from my research. I finished a master's in translational research and took a part-time job doing heart failure and VAD clinical work so that I could pursue music in the rest of my time. And I thought for sure that I would just do that for a little while and then go back to my real life. But it didn't take me long to realize that this is my real life. This is what works for me. And it's okay that I'm not like those other people. And I'm just so grateful that I had that realization so early on in my career. Music has been such an incredible tool for me to just process my life and to get all those emotions out. And of course, the pandemic was no exception. We've all had lots of big feelings. And one day when I was trying to homeschool my children, I do that in quotes because it was a total joke, I sort of began thinking, everyone was throwing around the term new normal in regards to the pandemic. And I thought, yes, this is a new normal like no other I've really experienced. But we've had other new normals. You know, this is a big seismic change in our life, but we've had those before, and we probably will have them again. And who is more resilient and resourceful than physicians? And it just sort of made me reflect, this is just another new normal that we're gonna get through. And it will prepare us in ways we don't even understand yet for all the new normals to come. So I'm gonna end with this song, and a big thanks again for including me. Praying type, but lately I've been praying to whatever's in the sky. It's just another new normal. You can't pick and choose the things you can take with you. Time has a mind that's all her own. She could take it all away, or she could kiss you. Send your sorrows on down the road. I've been trying to get used to a new normal. Feels like I always am. Just when I can't get used to a new normal, everything changes all over again. If it ain't one thing, it's something else. Ain't life just hellos and farewells? I've been trying to get used to a new normal. It's just another new normal. So much fun. Thank you. Thank you so much.
That was great. We have heard how music influenced medicine. We have heard how music influenced the physicians. And now we're going to hear how music has influenced SAGES. And there's no one better for that presentation than Sallie. You heard me saying thank you to Sallie as an executive director for SAGES. She has been the executive director for 23 years and has worked in SAGES for 28 years. She's also the president of BSC Management, president and CEO of BSC Management, and she manages, besides SAGES, another 13 surgical societies. She graduated on the Indiana University School of Music. Sallie sings and plays piano, and she lives in Los Angeles with her husband Jim, children Cole and Ella, and dogs Jake and Astro. It is truly, truly my pleasure to have Sallie giving a keynote speech. Sallie.
Well, good morning, SAGES. I would like to thank Dr. Asbun for the great honor of participating in this keynote. Earlier in life, I was comfortable on the stage playing and singing and speaking, but giving any part of a lecture is not yet in my skill set, so we'll see how this goes. I would also like to thank Karl Storz Endoscopy for their endowed support of this lecture since 1996. And I have nothing to disclose. Music and SAGES. This is my 29th SAGES meeting, and since those earliest years, I learned that SAGES is unique, and music is interwoven into our culture. My first interview with Barbara Bursey was early in 1993. I was 24 years old. My resume was a shameful compilation of part-time post-college jobs in Los Angeles and gigs, musical endeavors. I'm not quite sure why Barb interviewed me, much less hired me, but that's a different story. So I walked into her office. She looked up from my resume and said, "Do you know the Jewel song from the opera Faust?" Stunned, I replied, "Why, yes, I do." And a beautiful friendship and 25-year working relationship began. Music and SAGES. Music has helped give SAGES a family feeling. Music has enhanced our global outreach. Music and the annual Sing-Off have helped us achieve one of our core values of inclusion and, of course, our unofficial value of fun. We're not quite back to normal this year in Vegas, but if you haven't ever experienced a SAGES main event, I encourage you to do so. Many people dance, the old, the young, the introverts, the extroverts from all over the globe. And then, of course, a few of you brave the stage for the sing-off. I'd like to take you on a little musical history of SAGES, and then I'll end with a song. So 1992, before my time, and I am aware some of you were infants, this crew, coming off the heels of the laparoscopic revolution, formed the Lap Rappers. And you have here Jeff Peters, Steve Unger, Choichi Sagawa, Lee Swanstrom, that's John Hunter hiding in the back, Mohan Iron, Rick Green, Jeff Ponsky, Jonathan Sakier, Nat Soper, and George Bursey. They entertained the attendees at the 1992 meeting. They sang and they danced, and they did so for decades to come. They evolved and they included more leadership as time went on. And you won't hear them tonight, but you will hear from them again in the future. 1994, SAGES meeting was in Nashville. And after a VIP dinner, we went to a professional recording studio and we recorded In the OR Again, based on the Willie Nelson On the Road Again. I had the privilege of singing the verses with a surgeon named Adam Robinson, and the VIPs recorded the chorus. Adam Robinson went on to be Vice Admiral and Surgeon General of the Navy. And I'd like to give a shout out not only to him, but to all of our military surgeons in SAGES. We thank you for your service, and we thank you for being such a core part of the SAGES fabric. Yes. "1995, I'm so sorry I don't have a photo of this. The Lap Rappers again entertained, this time in Orlando, in front of Shamu Stadium. Jonathan Sakier and his wife wrote and produced a fully choreographed and costumed Disney medley. We sang and danced and laughed, and it was a magical time. 1997, these two, Manabu Yamamoto and Goro Kaneda, came to the president's suite, then Greg Steigman, and serenaded him, and thus began a beautiful annual tradition. The next year, 1998, based on the Lap Rappers and all of this music and fun we have been having, we had our first sing-off. That's a young Paresh Shah and Dan Heron you see there in the front. It was open mic. There was no production, no tech. Some of our Italian colleagues sang an aria. And for the first time, we heard the Japanese sing, "We Are the World, We Are the SAGES." And of course, that has been the closing song of every sing-off since. 2001, this shy, reserved, very serious surgeon from St. Louis, where the meeting happened to be, took the stage and literally transformed into Mick Jagger. Now, of course, that's Mike Brunt. Most of us had not seen him in that context before, and we saw quite a bit of Mike since that time. 2002, SAGES hosted the World Congress of Endoscopic Surgery in New York, and it happened to coincide on the 6-month anniversary of 9/11. Mike led several of his Wash U colleagues and several of us from SAGES in a moving tribute to 9/11. It's almost impossible to believe the 20th anniversary of that event is almost upon us, and we will never forget. Fast forward to 2007, music infiltrates the SAGES scientific program in the form of the Rocky Horror Video Complications Session. This CME accredited session was chaired by Nat Soper and Joe Beiske. Again, we were costumed and choreographed, and oh yes, we did the time warp. In 2010, we tried something new. We moved the main event to Saturday night, hoping to draw attendees to stay through the conclusion of the meeting. And side note, if you come to a SAGES meeting, please stay till the end. The presenters on Saturday really would appreciate an audience as much as the presenters earlier in the week. Anyway, we moved the main event to Saturday. We had no sing-off. Only the Japanese sang, "We are the world, we are the SAGES," but no sing-off. To say a small mutiny ensued is an understatement, and the sing-off returned the following year. 2014, SAGES in Salt Lake City, chaired by Jeff Marks and Tonya Young-Faddock. Aurora Pryor and Caitlin Halbert brought us SAGES Ladies, and they've been with us every year since. You might just see them tonight. 2015, Mike Brunt was president. He formed the President's Band. He brought his drummer from St. Louis. He invited me and Jake Greenberg and John Romanelli to join him on the world-famous stage at the Wild Horse Saloon in Nashville. And we rocked, and many of you danced, and it was a night we will never forget. 2018, SAGES in Seattle. SAGES and CAGS hosted the World Congress, and this young, brave soul, Anjali Kumar, did a solo act, her own rendition of a song from Hamilton, and you might just see Anjali tonight as well. 2019, braving cold and wind and not knowing it would be our last time together for quite some time, the Japanese led us in a very moving tribute to Barbara Bursey, who had passed the year prior. And again, they led us in "We Are the World, We Are the SAGES." Before I conclude, I'd like to offer just a couple of thanks. One, as Horacio mentioned, to my team at BSC Management. There are about 60 of us, and we provide management to SAGES, of course, but to several other professional medical associations. There are a little more than 20 of us here this week, and to that team, I am so grateful. I am in awe of the resilience you have shown in the last 18 months. I would also like to thank my husband, Jim, my kids, Cole and Ella. Like many of you, you can't do what you do professionally without the support from home, and it's no different for me. And so, honey and kids, thank you. I love you. We've missed each other these last 28 months since the last time we gathered together. We've missed music, and we've missed SAGES. I'd like to leave you with a song that I think I sing on behalf of us all, to each other and to SAGES. And if you're not here with us in Vegas, we hope and pray that we can safely gather again in 6.5 short months in Denver. You'll never know just how much I miss you. You'll never know just how much I care. And if I tried, I still couldn't hide my love for you. You ought to know, or haven't I told you so 1,000,000 or more times? You ran away and my heart went with you. I say your name on my every prayer. If there was some other way to prove that I love you, I swear I don't know how. You'll never know if you don't
know